It's an illness that affects tens of thousands of Utahns every year.
I can just remember just kneeling down and just shriveling up into a ball.
But now there are several epilepsy specialists working in our state. In our closer look at 615, where they've opened a clinic and how it could help someone that you love. 28,000 Utahns have epilepsy, and now they have a new option for treatment.
Epilepsy is a neurological disorder that causes seizures. The symptoms include blackouts, fainting spells, and involuntary movement. This evening, new hope in the form of a very specialized clinic. In tonight's closer look at 615, ABC4's Barb Smith shows us what it's doing for your family.
I can just remember just kneeling down and just shriveling up into a ball.
Jeremy Hema now has a son of his own. When he was a child, he had small seizures. As an adult, his epilepsy grew worse, taking away his ability to drive and live a normal life.
Everywhere I had to go, there had to be public transportation or somebody to take me there. That's what was very hard.
Epileptic seizures are caused by abnormal electrical signals in the brain. Attempts to manage his seizures with medication failed. Eventually, he found help.
Unfortunately, patients often have to struggle with uncontrolled epilepsy for more than 2 decades before they're finally referred to an epilepsy specialist who can help.
Dr. Constantino is one of only 3 epileptologists in the state of Utah. She is practicing at a new clinic in Murray. She says many people are unaware her specialty exists, including those in the medical profession.
If someone's seizures are not fully controlled within 6 to 12 months, then it's very important that they seek the care of a specialty-trained epileptologist.
And she says sometimes patients are reluctant to seek help.
A lot of times it's a family secret, and people don't tell others about their epilepsy because they either feel self-conscious about it or they don't know how someone's going to respond to that.
Dr. Constantino says the stigma needs to be removed and people need to talk about the disorder and the treatments available.
We have more and more options available for patients with epilepsy to help them get good seizure control or complete seizure control.
Jeremy Hema had brain surgery to correct his seizures. He has now been seizure-free for more than a year.
It's a great miracle. It's something I'll always look back on and something to be very thankful for.
For your family, I'm Barb Smith.
And if you can believe these numbers, 1 in 10 of us will have a seizure sometime during our lives. Epilepsy is the second most common neurological diagnosis behind migraines.